Dr. Mansour will present a workshop about Skinbuilder, the synergy of hydration and facelift for optimal rejuvenation.
Okay.
Your stage, please.
أنا في ناس كتير قالوا لي بره عايزين نتكلم بالمصري، فيعني هحاول إن أنا شوية أتكلم عربي مصري يعني وشوية إنجليش عشان الضيوف اللي معانا. أوكي تمام؟ ماشي؟ يلا بينا. انتوا ما تبقوا جاهزين انا جاهز. نبدأ؟ ماشي. طيب انا هقرب. ماشي. الاول احنا هنتكلم عن حاجه اسمها the map protocol. we'll talk about the map protocol. The result map protocol after 3 years. I will explain what is map protocol. But look now at the result. She was injected filler once. Only once. This is her face from a side view. For sure she did rhinoplasty, but look at the features. Look at the fillers. Same results after 3 years. Another case after 2 years. Look at the quality of the skin. Yes, better face, better shape. Injected filler once. Another view. And after 18 months, this picture was taken by the patient herself, another picture, and another one. All those cases, the map protocol was done here. Let's hear this video to understand what is map protocol. ممكن تشغله من عندك؟ شغله من عندك؟
The multi-layering anti-aging protocol, the MAP, developed by Dr. Ahmed Mansour, is fundamentally an aesthetic procedure, yet it serves primarily as a comprehensive treatment for the entire face. A deep understanding of facial anatomy is essential before initiating any injection process, with particular emphasis on the vascular anatomy. Moreover, it is crucial to recognize that the aging process affects all anatomical layers of the face, not just the skin. The facial layers include the skin, superficial fat compartments, the superficial musculo-aponeurotic system, SMAS, the muscle layer, deep fat compartments, and the underlying bone structure. Within the MAP protocol, each of these layers is deliberately and specifically addressed. The selection of each product and device incorporated in the protocol is grounded in robust scientific knowledge and refined through extensive clinical experience. Importantly, the anatomical layers of the face are not continuous open spaces. Rather, they are compartmentalized into distinct areas by retaining ligaments, which play a critical role in supporting facial structure and resisting gravitational descent. The M-lift technique, also developed by Dr. Mansour, allows for precise injections that produce a lifted facial appearance without resulting in undesirable volumization. This technique offers results that typically last 12 to 18 months. However, when performed in conjunction with the full MAP protocol, the results are significantly prolonged, often exceeding 36 months, while also promoting a more youthful, revitalized, and naturally refreshed facial appearance. The efficacy of the M-lift technique relies on two core principles: reloading skin tension and enhancing muscle tone through targeted deep layer injections.
زي ما اتفقنا ده كان the map protocol. الماب بروتوكول هو باختصار it's a full protocol to treat all the layers of the face. في big mistake ان الايجنج بيحصل على مستوى السكن بس، وده غلط. الايجنج بيحصل على جميع طبقات الوجه. زي فكره بالظبط ان احنا كنا في الراينو في الفيس ليفتنج كان زمان الجرح بيبقى شد للسكين بس، دلوقتي بقى اسمه ديب بلين فيس ليفتنج. بقينا نعمل ليفتنج لكل اللايرز اوف ذا فيس. ليه في شغلنا ما نعملش كمان تريتمنت لاول لايرز اوف ذا فيس؟ الفكر ده انا ماشي بيه وبجربه بقالي 6 سنين. عندنا ريزولتس زي ما انتم شايفين 3 سنين وعندي 4 سنين وعندي كل المستويات ان انا انجكتد فيلر وانس، وبعد كده بنعمل تريتمنت لاول لايرز اوف ذا فيس. هنتكلم عن ده بالتفصيل ويل توك اباوت ات ان ديتيلز on Saturday 9:30 in the morning. It will be a very long lecture. Yes. عشان ابقى قريب.
The multi-layering anti-aging.
حاضر. طيب احنا كنا اتكلمنا في الجزء اللي فات من المحاضره الاولانيه، اتكلمنا عن الاناتومي والفاسكولار اناتومي. مهم قوي ان احنا نبقى عارفين الاناتومي بتاع دي حاجه كلنا عارفينها وكل الناس عارفه. But what we don't know, this is the reality. So this is the theory. Yes, the facial is passing from here, but reality we have a lot of vessels in the face. So my choice in injection is 22 or 23 gauge cannula, not more than this. What about 25 or 27? You consider it as a cannula? Do you consider it as a cannula? For me, it's equal needle, the same. But the difference is one is sharp and one is blunt. مفيش option خالص. اهي okay. This is how I see the difference between the cannula and the needle. The same. And look at the face. This is the doctor surprised why I have complication after I injected with 25 or 27 gauge cannula. So it's totally wrong. Okay. Why cannula is important for me?
Back from the brink and is looking to put this one into the history books.
That's point for Yale.
Carolina finally pushed one through Stoney. Brown's down it.
Did I say that?
Here comes the spike straight to the man.
Lift down time.
The man.
Areas hard to
Legend! His teammates help him to his feet. No! They raise him heavenward.
He ascended through the air like a defensive angel.
An angel with the...
Not totally safe. Look at this case. This is my case. I injected here with 23 gauge cannula. But what happened here? Yes. It's not necrosis. No, it's not necrosis. I injected hyalase immediately after, so she is fine. But look at this nose. She came to my clinic, injected her nose with one of the best doctors in Egypt. I called her. I know her very well. Doctor, this happened. She told me I used cannula. But the question is, which size or compression or another thing? The vessels near to the cartilage in the nose. So if the opening of your cannula facing upward and you go through and you make tear to the vessel by negative pressure, it will be inside. How I inject the nose safely, we will say this tomorrow at 5 p.m. in non-surgical lecture. This is her nose. This is after 1 month of treating her. And finally, this is my message to all my colleagues. طب شغلها طب من عندك يمكن ربنا So don't focus on your work and forget the love in your life. This is my Instagram account. You can contact me anytime. We will inject now RRS, one of the MAP protocol materials which I use in Egypt. RRS, long lasting, is a material, cross-linked material. What do you do to your patient when she come asking you for a skin booster to lift the face? Skin booster for lifting, right? For lifting? Skin boosters for tightening. One of the famous brands, they lost their reputation because in the beginning they marketed it as a lifting product. Skin boosters, either cross-linked or not cross-linked, is not a lifting material. It's a tightening material. What's the difference? This is lifting, moving tissue from a place to a place, it's lifting. Moving tissue in the same place, it's tightening. And this, what we use here, long-lasting for. RRS long-lasting, it's a cross-linked. So don't treat it as a regular skin booster. It's not cross-linked, so if it's go to the vessel, it's normal, or we have no problem. No, we have problem because it's a filler, okay? So injecting it with cannula is the best option. What's the best thing in it? It is, I found it one of the best cross-linked skin boosters ever, because it works as a builder of the skin. So in my MAP protocol, which we will discuss it on Saturday, we have many layers to treat. One of the layers is the skin. So I want to treat it either by rebuilding the skin, and I need very soft filler to camouflage everything superficially. So this is what we will do now, or what we will use now in RRS long lasting. If you have any question according to the idea of MAP protocol, Saturday we will complete. Yalla. حبيبتي شكرا. Yeah, that's fine. In previous patient, we discussed the vascular anatomy. But what's important now, because we are talking about MAP protocol, in MAP protocol, we want to do biorevitalization of the ligaments. As long as we are doing biorevitalization of the ligaments, so we need to understand where is the ligaments. Zygomatic cutaneous ligament. Masseteric cutaneous ligament. It should be lines.
Wait, Dr. Mansour, we need the screen because we are still watching your photo, but not the patient. The screen, please, for Dr. Mansour. Excellent.
Yes, okay.
Wait. Okay, go ahead, please.
Okay,
Thank
I'm
you very
drawing
much.
the ligaments. As long as the main core and the main idea in MAP protocol is after we do lifting of the face, whatever the method, by facelifting surgery or by threads or by fillers, our ligaments is loose, is not tightened. So we need to do biorevitalization for the ligaments. As long as our product here have double action on the skin and hydration and biorevitalization for the tissue of the face, whatever the tissue we are injecting it. So we will inject RRS long lasting in many layers. Masseteric cutaneous ligament, zygomatic cutaneous ligament, orbital retaining ligament, and mandibular ligament, which creates the superior jowl and inferior jowl, and fat compartments. So when we inject RRS long lasting, we can use it to biorevitalization for all the tissues, fat, ligaments, and superficial for collagen and elastin stimulation. And we'll show you now the levels of injection and where to inject. أنا عايز كحول. معلش أنا حاولت أتكلم مصري بس للأسف في ناس أجانب فإحنا عايزين يعني إن يبقوا سامعين كل حاجة. بس أعمل لكم محاضرة تانية لوحدكم براحتكم يعني. يلا. The entry point, the same entry point as we did the last time. I want to go with my cannula everywhere. And I do not want to harm most of the tissues, which is happening when we open near. معلش السايز بس صغير شوية بتاع الجلوبس. راعوا بعد كده. طيب. RRS long lasting 3 ml of cross-linked skin booster. يلا عايز cannula. When I go to any conference, my cannula always in my pocket. 22, yes, okay. As we said before, you open your syringe. You make sure that you open the right syringe. I want to know where to inject. This is my cannula. I measure it. I can go everywhere. I will not miss any place of the face. So the opening part would be here, in the middle of the face, with only one opening. I do not need more than this. 5. Pinch the skin to stretch it. Very minor puncture. Very slow, very smooth, no bleeding as you see in the previous patient and you're seeing now. When I insert my cannula, perpendicular. When I passed the first resistance, this is the derms. Any other resistance I will find, it's either two things, either ligament or muscle. According to the place, I will understand. Now, I need, in this area, she have a very good face. She don't need anything except collagen stimulation or biostimulation. So, I would go superficial for this case, for biostimulation. As you see now, the tinting show you that you are superficial. I'm injecting the face. While I'm doing this technique, which I did in the previous case, it gives me a lifting. But does it last? No, it will not last. It's only there at the injection time. Molding of the fillers. I'm going superficial also. All this to stimulate the skin. And as long as this is a cross-linked filler, so I can use it for changing the shape, but very minor changes, very minor. So where I gonna use it? ممكن تقعدي اوريهم حاجه. انا بحب قوي استخدم اللونج لاستنج لاني كنت بطلت احقن النيزوليبيال خلاص. يعني after the lifting technique I'm using to the patients the way I'm doing it اللي هوريها لكم ان شاء الله يوم السبت، بطلت خلاص احقن النيزوليبيال. بس لو انا عندي لاين في كسره في الجلد, I have a crack in the skin, I want to treat it, I want it better. Why not using something like this? Look at the marionette. It's very little, but I can use it here, very safe, but with very minimal amount. So I injected now, very superficial. We don't have any shape here, it's just for biostimulation. What if I want to treat the ligaments? I can go deeper as long as I want to treat deeper tissues. Now I am all the way deep in the face above the muscle. I can inject in this layer, but in her face is already big and swollen, so I don't need more than this, but I'm showing you where I can inject. ممكن أنا عايز أحقن النازوليبيال الماريونات. أنا عايز أوريه بس الناس النازوليبيال الماريونات. In the past, I used to inject the nasolabial both deep and superficial. But after the case I showed to you in the presentation, I only inject the nasolabial superficial, only superficial with cannula. Because I'm sure that the vessel is all the way down. In the past, my entry point was here. But if I'm going from here, I can cannulate the vessel itself. But when I go perpendicular, I would go perpendicular to the vessel. أنا عايز شاشة بس. جوز شاشة. I'm going perpendicular here, then perpendicular on the line. I'm very superficial. I'm sure that the facial artery is all the way down. I'm injecting very little amount just to stimulate collagen and elastin to treat those cracked lines. Or we can inject superficially, we can inject amber as in the previous session. I want to inject more of the line. Be very superficial here because the superior labial here is a little bit superficial, and in the lips, by the way, in the end of the lips, it starts superficial, then it goes deep here. The marionette also can be injected. It's 3 ml, so I can inject many layers, many places, all at the same place. Look here. I'm injecting the marionette. Someone asked me before, can I inject it in tear trough? Yes, I can inject it in tear trough. Where? Yes, deep is better place. What if I inject it superficial? Be aware of, this is not a complete or total skin booster. It is cross-linked. So you may have a Tyndall effect, and I see it many times because it is widely famous in Egypt, RRS long-lasting. Everyone is using it. So I see many cases of wrong injections. So you as a doctor, you need to understand what you are doing and what you are injecting in your case. ممكن تقعدي؟ بصي للكاميرا. Don't smile. Focus. Look at the nasolabial. I can correct it. I can inject it. But the other side, لا خليك انت بعينك هنا. انت قاعدة تتفرجي. Look at the nasolabial, it's better. We can inject both sides, and it's very good for cases you don't want to inject the nasolabial itself, because you will enhance the collagen and elastin, and you will give lifting by fillers for the face, and she have a better nasolabial, but here need to be injected more. Okay. For me, this is one of the best options in RRS long-lasting. Also in cases with very, very, very thin skin, when I want a very 3 minutes?
Thank you, Dr. Mansour.
Dr. Mansour.
Yes?
Thank you for your presentation.
Okay, no, thank you.
You can finish the other side, and then
okay.
we will appreciate the results on the face.
Pour sa présentation, c'était le laboratoire Norok avec le Lola.